Post is a written order. That's what we want to find at the scene. Without legal guidance, we have to do everything in our ability to resuscitate a patient.
POST stands for Physician Orders for Scope of Treatment. POST allows patients to choose treatment options compatible with their values and goals, and is designed to translate patient preferences into actionable medical orders that guide treatment during a time of crisis. The centerpiece of the POST program is the POST form. This bright pink form includes medical orders for resuscitation, medical interventions, and artificially administered nutrition. This form is for patients near the end of life who want to be sure their preferences for medical treatment are known. The time to complete a POST form is after you've had a conversation with your patient or their legally authorized representative. Once completed, a POST form should be revisited each time there is a change in the patient's medical condition.
Without an effective conversation with the patient or the patient's legal representative, the POST form is just a piece of paper. POST provides a framework for having and documenting this important conversation. An effective conversation should explore the goals of care, personal culture and desires, patient preferences, and who will speak on behalf of patients if they cannot speak for themselves. Specific discussion points can include chances of recovery and options for treatments with respect to quality or length of life.
POST is designed for patients with advanced chronic progressive illness, such as end-stage heart or lung disease, advanced chronic progressive frailty, or terminal conditions such as advanced dementia or cancer that is spread. It is also for patients who are unlikely to survive cardiopulmonary resuscitation. POST is not for everyone. Most 65-year-olds are too healthy to have a POST form. If something suddenly happened, most healthy seniors would request full treatment and learn more about their condition and chance of recovery. As they age, become sicker or more frail, the senior or their appointed representative can talk with their physician about the POST form to make sure that their wishes are recorded as medical orders.
Helping patients identify their goals can help lift the burden from family members. When patients complete a POST form to make their preferences known, it helps guide both the family and the clinical team in a time of crisis.
Here's a detailed look at Indiana's POST form. Section A outlines decisions regarding resuscitation, specifically CPR. For patients with advanced illness or aging, CPR is not likely to be effective. Resuscitation is successful in less than 3% of frail nursing home residents. When patients understand their disease process, most who are on hospice or long-term nursing facilities choose the option to do not attempt resuscitation, also known as a DNR order. Section B outlines decisions regarding medical intervention, specifically whether to return to the hospital and the intensive care unit or ICU. Some patients wish full treatment, including life support measures in the ICU. This includes intubation and mechanical ventilation. Without a POST form, this level of treatment is automatically provided. Other patients choose limited additional interventions, which can include transport to the hospital to receive basic medical treatments. These patients generally wish to avoid the ICU and intubation, but want more easily addressed conditions treated. Additionally, some patients choose comfort measures. This choice focuses care on maximizing comfort through symptom management, allowing patients to spend more time with family and less time at medical appointments. These patients prefer not to be hospitalized. Sometimes this choice is referred to on the POST form as allow natural death. No matter which options are chosen on a POST form, comfort measures must always be provided. Section C outlines patient preferences for use of antibiotics. The options include using antibiotics in a way that is consistent with the orders in Section B, or using antibiotics for comfort purposes only.
Infections such as skin infection or urinary tract infection require treatment with antibiotics to ensure comfort. However, there are other ways to keep patients with conditions such as pneumonia or sepsis comfortable if they do not want antibiotics.
Section D outlines patient preferences for artificially administered nutrition. Food and fluids are always offered by mouth when feasible. Some patients would prefer long-term artificial nutrition by tube. Others may want a feeding tube only for a defined trial period.
Two of the most important things that we can provide to seriously ill patients, especially near the end of life, are comfort and company. For patients with advanced dementia and other progressive neurological conditions, losing the ability to swallow safely is part of the illness. While the inability to swallow indicates that we are entering the final stages of the illness, it also can raise difficult decisions about care. Artificial nutrition and hydration, like tube feeding, have not been shown to extend life or improve health, and may even add to discomfort. Slow feeding by hand is an alternative that allows patients to enjoy the taste of food as well as the caring human contact that comes with such feeding. If comfort and company are the goals of care, slow feeding by hand may be a better choice than tube feeding.
Section E outlines that the post conversation occurred with either the patient or a legal representative. The patient should sign the form if he or she is able to make his or her own healthcare decisions. If unable to sign, a legally authorized representative will sign in place of the patient. In Indiana, a legal representative can be the healthcare representative, power of attorney for healthcare, or a legal guardian of the patient. Family members cannot sign unless they are legally appointed representatives. The back of the form includes a line to indicate the name and the contact information for the patient's legal representative. Even if the patient is able to sign, it is important to include this contact information so it can be found easily in an emergency. Like any valid medical order, post forms must be signed and dated in order to be valid. A physician, advanced practice nurse, or physician assistant may sign post orders. The post form can also be prepared for physician review and signature by a physician designee. If another member of the healthcare team, such as a nurse or social worker, engages the patient or authorized representative in a goals of care conversation, he or she would post his or her name and title on the back of the post form.
Post is entirely voluntary. An institution may have a policy that routinely offers a post form to ensure that people have the opportunity to complete one. However, no one can be required to have a post form.
If a patient refuses a post form, this must be documented, and the healthcare team should not approach the patient about post again unless his or her medical condition changes. A patient can also revoke his or her post form or have a new one written. And it's not unusual for patients to have more than one post as their disease progresses. The most recent post form will be honored. Once signed, the post form should remain with the patient whenever possible.
There's some sensitivity about when to bring up post or how to bring it up. But there are actually a lot of opportunities. If a person has had a bad turn or a change in their health, that's an opportunity for a discussion. I like to start the conversation, if I can, before people are in the hospital or nursing home. Many people with chronic illness have thought a lot about what they would want in the future and what they don't. So to have an opportunity to discuss their wishes, a doctor must be concrete and specific.
The Indiana Post is based on a model that was developed in Oregon over 20 years ago. This approach is now used in a growing number of states and is increasingly recognized as the preferred standard of care. Research indicates that the Post is better than traditional approaches at ensuring that treatment preferences are honored. The Indiana Post became available in July 2013. The form can be downloaded from the Indiana State Department of Health or the indianapost.org website. Although the color pink is recommended, it is not required. Faxed or photocopied forms are also valid.
I've learned from my practice that post really helps the patients and their families. It helps them get the care they want and not the care they don't want.